This video shows a fairly typical rotator cuff tear. Here you see a torn portion of the rotator cuff tendon. Here we are with a grasper pulling the rotator cuff tendon back down to a portion of the humerus bone where it belongs. And the goal of this operation is to secure that rotator cuff tendon back down to the bone where it belongs. Here we are putting in what's called a carbon fiber anchor. This material is especially strong. It gets completely embedded in the bone. There are 3 sutures attached to that anchor, which you saw being screwed into the bone. We pass the 3 sutures through the rotator cuff tendon individually. Here you see us passing the sutures. There's a number of very specialized instruments that are used to pass the stitches through the rotator cuff tendon. Here you see an example where the sutures have been passed through that rotator cuff tendon individually, and the next step in the procedure is to tie those sutures down such that rotator cuff tendon is secured to that portion of the humerus bone where it belongs. And you can see here we are tying sutures again with specialized arthroscopic instruments through what's called a cannula. This suture is, although it looks rather large on the screen, is actually very small and very, very strong. Here you see the sutures that have been passed through, tied down, and as we're moving the arm you can see that entire rotator cuff, which has been repaired, moves as a unit. The final step in most of our rotator cuff repairs, a lot of times people will develop what's called a subacromial spur, or a extra bone on the underside of the acromion. Here we are shaving that down. If we don't shave that down, what will happen is that acromion bone will actually impinge on the repaired portion of the rotator cuff. Here you see, following what's called decompression, or shaving of that bone, that bone's nice and flat, and here we see that rotator cuff moving nicely underneath that bone spur which has been shaved away.